That sound you heard, that's the sound of modern society ending a night of sleep. And that feeling you potentially just had, that tells you just how much we value our sleep. Unfortunately, insufficient sleep is all too common. About 1 in 3 adults in the United States regularly sleep less than the recommended 7 to 9 hours per night. Excuse me. My name is Chris Depner, and I'm an assistant professor in health and kinesiology, and my lab's research is focused on understanding why insufficient sleep is linked with risk of type 2 diabetes and what we can do about it. I want to take you back to my PhD in nutritional biochemistry. At that time, I had this idea that if we could just understand exactly how our food impacted all these complex biochemical pathways, we could prevent diabetes. Unfortunately, something was missing from my thinking at that time. Something completely absent from this slide. That is time. Near the end of my PhD, some findings were published showing that the timing of food intake is just as important or even more important than the type of food we eat when we're thinking about all these pathways. So yes, fat, sugar, protein matter, but so does the timing of our food intake. Let me explain a little bit further. As Earth rotates on its axis, it creates very predictable light-dark cycles. It turns out our circadian clock is adapted to help us exactly predict these cycles. For example, our clock tells us when we should be alert and when we should be sleepy. It also tells us when we're hungry and therefore when we should eat food and we're ready to digest it. Unfortunately, in modern society, with 24/7 exposure to light and food intake, with 24/7 exposure to light and food intake, our clock have become really misaligned from these natural light-dark cycles. And we think that has very severe health consequences. I was so enamored by this idea of circadian timing and physiology, I studied it further as a postdoctoral fellow at the University of Colorado. I worked there with Dr. Ken Wright, an expert in sleep and circadian physiology. One of the first studies I worked on was a winter camping study. This was very simple but elegant. We took our participants and just had them go about their natural daily lives with electrical lighting. We took them into the lab and measured the timing of their circadian clock. Then, we took everyone camping for a week in the mountains of Colorado, over the winter solstice, mind you. The catch was no electrical lighting, so only exposure to sunlight and campfire. Immediately after camping, we took everyone back to the lab and measured the timing of their circadian clock. It turns out, regardless of where people started, everyone aligned to sunrise and sunset perfectly after that week of camping. This is simple, but it tells us just how much modern society with electrical lighting is disrupting or misaligning the timing of our circadian clocks. And we think this could be a key factor disrupting our sleep and increasing risk of diabetes. So as I wanted to study this further, the University of Utah rose to the top of my list for places to start my own independent research lab. As you can see here, obviously the University of Utah is a very beautiful campus right at the base of the mountains. And for me, that was really important. Additionally, the University of Utah is a very unique among public institutions. It has a world-class health sciences campus directly next to the traditional academic undergraduate campus. This allows us to do our cutting-edge research while also bringing undergraduates along and giving them this firsthand experience and learning the research literally hands-on. This is an experience they otherwise would not get at many institutions. So as we continued this line of research, we wanted to ask a simple question. Can you catch up on your sleep over the weekend? So to answer this question, we recruited participants into the lab, and they got randomized to one of two conditions. The first was sleep restriction. So they got 7 days of insufficient sleep. The second was sleep restriction, Monday through Friday, but then they got the weekend where they could sleep as much as they wanted. Our main outcome of interest here was insulin sensitivity. It's a major risk factor for type 2 diabetes, and higher levels represent healthy insulin sensitivity. Lower levels represent impaired insulin sensitivity and thus risk for diabetes. So after the 7 days of sleep restriction in the first group, we can see their insulin sensitivity was impaired. In fact, some of these participants were at levels that would be considered pre-diabetic. So what happened with that weekend recovery group? Well, they definitely slept more and they felt better. They felt less sleepy, more alert. But what about that insulin sensitivity? Unfortunately, it was still impaired after that weekend of recovery sleep. So even though they felt better, physiologically, their bodies had not recovered. This created a natural question. If a weekend's not enough, how much is? And I'm happy to say we are following up on that. We also tracked some other behaviors in this study, namely nighttime light exposure and nighttime food intake. And we found that the participants that had the highest levels of these behaviors were the ones who had the greatest impairments in insulin sensitivity. So that led to the hypothesis that perhaps these behaviors are contributing to risk of diabetes when people are getting insufficient sleep. I'm really happy to say we have 2 large NIH-funded trials focusing on just these questions. The first one is a randomized controlled trial. It's an 8-week sleep extension intervention or a control group, and it's among participants with habitual insufficient sleep and higher risk for diabetes. We're also tracking that nighttime light exposure and food intake. Our key outcome of interest is insulin sensitivity. So really the key question is, does this 8 weeks of increasing sleep improve risk factors for diabetes? This is an ongoing study. We have about 2 years of data collection left, but our early data are promising. Participants are sleeping about 1 hour more per night, which is really great, and their sleep quality is improved too. So hopefully that marker of insulin sensitivity also improves, so stay tuned. This is really great, but I can also hear you saying, there's no way I can actually increase my sleep for 8 weeks, or maybe even longer if that's what's needed. We're doing a really cool study that applies to you too. This one is trying to identify interventions even if sleep loss is unavoidable. So we're going back to the laboratory for this study, and participants complete 3 conditions. The first one is late night food, or work week of insufficient sleep with late night food intake. The second one is a work week of insufficient sleep with late night light exposure. And the third condition is that work week of insufficient sleep with those behaviors removed. Our hypothesis is that this third condition is going to protect participants from that risk of diabetes. If that pans out, that'll help us develop new interventions that could potentially maintain your health even when sleep loss is unavoidable. The study is also ongoing, so we hope to have promising findings soon. And with that, I really just want to thank my lab. These studies are really complicated to run. We have participants living in the lab for 10 days at a time, 24/7. We provide all their food, so it's like we're running a little hotel on campus. So I wouldn't be here today talking about any of this without this amazing team of people. And with that, I hope all of you can get your perfect 8 hours of sleep every night. But we also know that's not realistic and not possible all the time. So just know that we're out here doing our sleep research and literally sacrificing our own sleep to help improve and create new interventions for all of you when sleep loss is unavoidable. Thank you.